Historically, patients with metastatic prostate cancer would be followed after starting a treatment like Leuprolide every 3 months. As long as they were responding and their PSAs would go down, they may see the urologist or the oncologist while they would get their injections. And that type of intensity was really because there was nothing else you could do except the androgen deprivation therapy. In the setting of docetaxel for hormone-sensitive metastatic prostate cancer, we're seeing these patients every 3 weeks, obviously, because we're giving them chemotherapy during that initial period, in addition to androgen deprivation therapy. So we're seeing them much more intensively. After the 6 cycles of chemotherapy are done in a patient such as this, though, the question is, how often should you see them? Should you switch back to the every 3-month visit, or should you still maintain that level of follow-up? And typically, for me, it depends on what's happening to the patient. We are following them more intensively after chemotherapy because chemotherapy is associated with a lot of side effects. So as long as they're starting to recover and as long as they've had an appropriate response to hormones and chemotherapy, I may start to transition to an every 3-month follow-up visit. Otherwise, I may follow them more closely.